Hello, everybody. Today's topic is what is free care and what does it mean to me? I'm Bob Bundy, your presenter. My contact information is on the screen for a second while I cover our ground rules for the Lunchinar. First, all of our Lunchinars are targeted at 30 minutes. This one's going to be a few minutes longer, probably about 36.2 minutes, right in there. Second, we don't talk about anything state specific. Now, a little bit about our Lunchinar series. We try and give at least one Lunchinar on school Medicaid every month during the school year. We take a couple months off in the summertime. All the Lunchinars we give are designed to present information on a single topic we think folks in school Medicaid either want to know about or should know about. So if you're interested in future Lunchinars, go out to the website, go to the events tab, read up on the Lunchinars and register for ones that you're interested in, just like you registered for today's. My objectives for today's session. First, I'm going to give you a definition of free care, and I'm not going to give you just two quick sentences that kind of leave you puzzled. I'm going to give you a little bit of historical perspective about where free care came from and what it means to us today. And I'm also going to talk to you a little bit about how it's being implemented, what's going on around the country with free care right now, because it's been a pretty slow adoption rate. And last, I'll talk about the impact of free care from three different perspectives. If free care comes to your state, I'm going to talk to you about the impact that that might have on the school Medicaid agency or the state Medicaid agency, school districts, and billing companies. Interestingly enough, we have a lot of billing companies who participate in the Lunchinars, and it's very rare that I have any material specifically targeted for them, so I hope this is helpful. All right, so what is free care? First, we have to step into the Wayback Machine. And if you people listening don't know what the Wayback Machine is, you really need to go out and learn about the Wayback Machine and Mr. Peabody. You need to study up basically on your 1960s cartoons. All right. I suggest after the Lunchinar is over, you cancel all your meetings, cancel all your appointments, and just surf the web for 3 or 4 hours. While you're out there, make sure you look up Boris and Natasha. Make sure you look up Rocky and Bullwinkle, and my favorite, Johnny Quest. So we're going to go all the way back to 1965. 1965, Medicaid is authorized, not school Medicaid. Medicaid, the big Medicaid program. Can't have school Medicaid without a Medicaid program first. 1975, we get Public Law 94-142, which is the federal establishment of special education regulations at the federal level, comprehensive. It set the requirements, set the funding, which we all know is pretty insufficient at the federal level, and it defined those related medical services. And this is important for our free care story. At that time, that law was called the Education for All Handicapped Children Act. And that's going to be important in just a minute, okay? So we zoom up 13 years to 1988. School Medicaid is authorized. Public Law 100-360, defined by which is the Medicare Catastrophic Coverage Act. Great, big, huge act. I mean, it's huge. And it's got one tiny little paragraph in there about school Medicaid. And here is that paragraph. Now, I'm not going to read it to you, but I'm going to explain it to you. In that big act, this does not say the Congress authorizes school Medicaid reimbursement. It doesn't say that. What it says is there's nothing in the law that prevents schools from filing for reimbursement from Medicaid for services basically provided around special education. And you can see the terminology they used. I highlighted it there: IFSP, IEP, and the title of that special ed law in 1975, the Education of All Handicapped Children Act. So they basically say there's nothing in the law that prevents schools from billing for Medicaid around special education services. Okay. We move on. Now, at that time, let me say before I move on to 1997, there were no state plans that took into account school Medicaid because nobody had really done it before. So basically, when that law, this law right here came out, everybody starts writing their school Medicaid plan in the states. Okay. And they all looked at this language, and this language is very dependent on special education services with the IEP and the terminology that they use there. So almost all the state plans that states wrote to create a school Medicaid program had language in it around special education or tying it to special education services. Okay, something to consider. 1997, the special ed law is reauthorized as IDEA, the terminology that most of us know today, and CMS came out with guidance on free care, and that's where this term free care came from. And this is what that guidance is all about. First, let me explain. About 13 to 15% of all the kids in public schools around the country receive special education services. So by 1997, we know that school Medicaid covers those special education services. We know that. So let's just set that aside for a minute, okay? Because CMS's free care policy guidance covered the other 85% of kids in schools. Those could be kids with a 504 plan or an individualized health plan or no health plan at all. These are all the kids who are not receiving special ed services. And again, I'm not going to read you their very dry language. I'm going to give you the example. We're in a school district and we have 2 kids in our school district. One of these kids is Medicaid eligible and he's enrolled in Medicaid. One of these kids is not. He might be covered under his parents' private insurance or something like that. Okay. Both of these 2 kids go to the school nurse every single day to receive the same service. Maybe it's a medication administration of a controlled substance or something like that. Here's where the free care guidance came in. CMS said, school districts, you cannot bill Medicaid to reimburse you for the services you provide to this student if you provide that same service to this student or any other student free. And we are providing it to that student free. We're not charging his parents to administer that medication. We're not billing their insurance or anything like that. So CMS's free care guidance said you cannot bill Medicaid to reimburse for Medicaid eligible kids for services that you're offering other kids for free. That's where free care guidance came from. And that was the law of the land starting in 1997 because they put it, and again, it was guidance. It was in a letter. Let's fast forward to 2014, which was 4 years ago now because it came out right at the end of the year, right before Christmas 2014. So a little over 4 years ago. Okay. CMS wrote a letter, another letter out to the big wide world. And basically it said, hey, remember back in 97, we gave you that free care guidance, can't bill for reimbursement for these services if you're providing the same service to other kids for free. Remember that guidance? We take it back. You can bill for reimbursement for services to those Medicaid eligible kids, even if you're providing it to other kids free, if your state plan allows it. Okay, that was a big deal. That was a big change. That affects 85% potentially of the kids in our school districts. So, according to the change in guidance in 2014, you now have the ability to bill for reimbursement for covered services to Medicaid eligible kids, Medicaid enrolled kids, if your state plan allows it. And that's the rub. Remember I said when everybody wrote their state plan, they looked at that original language from the Congress that had all that special ed law in it, and just about everybody wrote their school Medicaid plan referencing special education laws, special education services, and those kind of things, which means that CMS changed this policy in 2014. And that's great, but everybody's state plan, and I shouldn't say everybody, every state plan I've read, doesn't mean that, I certainly haven't read them all, and it doesn't mean that there weren't some like this, but every state plan that I've read limited reimbursement for school services around special ed services. So CMS comes out in 2014, and that means that if states want to take advantage of that, they have to alter their plans. So where are we today? States who want to take advantage of this change in guidance have to make sure their state plan allows it. Most of them don't. So they need to change their state plan. And when you want to change your Medicaid plan in a state, you file what's called a state plan amendment or a SPA. And basically you fill out exactly what you want to do with your state plan and you send it to CMS in Washington, D.C., and they review it and ask you questions and all this kind of stuff. And ultimately, even with a few changes, they will probably approve it and send it back to you. You have to go through that. Now, that can take a few months depending on what you're after. But today, only a handful of states have done this. And you might think after 4+ years, there'd be more states. There are only a handful, and here are a few examples. Connecticut sent in a SPA, it was approved, and it basically says we want to add reimbursement for services on a student's 504 plan. So they very narrowly said we want to add reimbursement for these additional services. They have to be listed on a 504 plan. Louisiana did the same kind of thing. They said we want to add reimbursement for services in nursing services. They didn't open it wide up, but there are some other states that have opened it wide up. So California, Florida, New Hampshire, Massachusetts, all of those states wrote their state plan amendments to take advantage of free care by removing all the special ed language. So before, their state plan might have said something like reimbursement for this service is available to students with special education services. Now their state plan would say something like reimbursement for these services is available to any Medicaid eligible student. Okay, so only a handful of states. And why? Why not more? Why are more states not doing this? And I have a couple reasons down here. Some of these that I've thought about, some of these that people have mentioned to me. Not really sure in any particular state why it hasn't happened. Maybe it's just not on their radar screen, okay? Here they are. In 2009, we had the Affordable Care Act. And if you guys remember, one of the mandates of the Affordable Care Act was that every state had to expand their Medicaid program. Boom, here comes the Supreme Court and overturns that mandate. So now it becomes optional. And many states chose not to expand their Medicaid program. It's a big political hot potato in a lot of different states. Well, if the state Medicaid agency came along and said, hey, we want to expand reimbursement in the school Medicaid program for these students over here, that might not be politically viable in that state. And so it's kind of a back burner kind of thing in that state. That's just one potential thing. The other one, next one is the SPA process. When you're going to turn in a state plan amendment, here's the rub. You're a state Medicaid agency, you fill out your SPA, you send it to CMS. After a month, they review it, they send it back, and they say it's approved. But CMS also has the right to make you change anything else in your state plan that they want you to, even if it's something you didn't put in your SPA. So you send in a SPA saying, we want to take advantage of free care and change our state plan. CMS approves it, sends it back and says, okay, great, here you go. We need you to change these other 25 things in your school Medicaid program. And a lot of states don't want to go through that. You know, their state Medicaid or their school Medicaid program is stable. Sometimes they haven't changed it for 10 years or so. And they just know if they turn in a SPA, it's going to cause all kinds of other changes that maybe they're not prepared for. And then the last one is a concern that some people had probably 3 or 4 years ago, that some states would take advantage of free care. They would expand the students that they could bill reimbursement for, and their total revenue at the individual school district level could actually go down. Okay, now I'm not going to cover that in a lot of detail, and that's not a concern in a fee-for-service state. It was really a concern in a cost reimbursement state, and it really had to do with the way costs are calculated and some of the ratios that school districts are required to use, and by going to free care, they'd have to change some of those ratios. So that was a big deal. And some cost reimbursement states actually came out and said, hey, because this could negatively impact our total revenue to our school districts, we're just not going to go after it. And to those states, I would say you guys should take a look at the Massachusetts state SPA for school Medicaid, because they solved for this potential issue in their SPA. And that's something that I think a lot of cost reimbursement states could look at and say, oh, I see how they're doing that. So anyway, those are some of the reasons that folks maybe have not. Okay. Now, I've tried to kind of give you guys a real life definition of free care, kind of tell you how it got to where it is and sort of what the state of free care is around the country. One thing I forgot to mention, if any of you are in states that I just didn't mention, that are kind of going down the free care route, you know that there are discussions, you know that maybe there's a SPA being written or something like that, please let me know. I like to collect this information. I like to know what's going on. And a lot of people call me and ask, well, what's going on around the country, that they can kind of compare notes. Okay. All right. So now I'm going to talk about how free care affects different folks in a state when it's adopted. And I'm going to start with the state Medicaid agency. So if there are any folks from state Medicaid agencies listening today, thank you. Thanks for joining us. And I hope this is good information for you. This is how free care could affect your agency moving down the road at a high level. So there's the pre-free care world. That's because you haven't done a spa yet. It hasn't been approved. What could happen? Well, one of the things that could happen that I've seen around the country is you could get involved with your legislature real quick. I don't think this happens in every state, and I don't think this has to happen in every state, but in at least 2 states, California and New Hampshire, the state legislature has passed a law that has been signed by the governor, and both of those laws direct those state Medicaid agencies to create a spa to change their school Medicaid program to take advantage of this free care guidance change. So both of those legislatures really do that for or direct their Medicaid agency. Now, I don't think that they did that because, I don't know. I don't know the politics in those states. I don't know if they're mandated maybe by their state constitution or some other regulations in their state. Or if somebody just thought that, school Medicaid is such a tiny part of every state's overall Medicaid program. Maybe the state Medicaid agency really wants to do this, but it's just so low on their priority list because there's so many other important things. We'll pass a law that will help us readjust their priorities. Okay, I don't know the reason, but it could happen. There are a couple of other legislature kind of stories, but I really don't have time to pass those along right now. The other thing that could happen, obviously, is if you're going down the road, you're going to have to create a spa, which means you're going to have to write up a spa explaining how you're going to change your program to take advantage of the free care. You're going to have to work with CMS, go back and forth. If you're from a state Medicaid agency, you know all about that part already. But you need to decide how you're going to word your spa. Connecticut worded their spa just to open up services that were on a 504 plan, kind of a narrow opening of their school Medicaid program. Massachusetts or California opened it up wide open. They didn't limit it to just 504 kids. They said they just basically removed any qualifiers and put in any Medicaid eligible student who receives this service. So you have to decide, are you going to do kind of a narrow spa or are you going to do more of a broad spa? And the recommendation or the suggestion that I give to people is to go broad, write it up broadly, even if you only implemented it for 504 plan or kids who have 504 plans. If you decide 2 years from now that you want to expand it further, you don't have to go and do another spa. So you might write your spa to be broad, but only implement it narrowly. Now, if there are any people on from Wyoming, and I know we have a regular group of people who join from Wyoming, for everybody else, Wyoming is the only state that does not have a school Medicaid program, but they have a bill going through their legislature right now, and it looks like it has a really good shot at passing. And if it passes, the legislature is directing the Wyoming Department of Health to create a school Medicaid program. And I did a webinar for Wyoming people a couple years ago, pretty much had everybody on the state on there because they didn't know what was going on about school Medicaid, but it didn't pass 2 years ago. But some folks from Wyoming have continued to stay on. They say that they're just trying to educate themselves, in case it does pass. If it does pass, I'm very hopeful that the Wyoming Department of Health writes their school Medicaid spa very broadly, doesn't write it around special education services like everybody's original school Medicaid program years ago. And I hope they do that, even if they just implement across school, across special education services. Again, so if they decide to open it up to other services 2 years from now or 4 years from now, they don't have to write another spa. Okay, a couple of other things about the spa. California and New Hampshire did a really smart thing. They write their spa, they send it to CMS, they say, hey, we want to file for reimbursement for all these additional kids over here, all these additional Medicaid eligible kids. And they asked to add additional services in their school Medicaid program. Okay, so free care basically just means you're going to file for reimbursement for more students who are Medicaid eligible, but you've got a certain list of services. California and New Hampshire added additional services. Great idea, and CMS approved those. That's fantastic. So not only are they going to be able to bill for reimbursement for all these additional kids, but for all the kids in their state, they can add all these additional services, a lot of mental health and behavioral health services, which are a big deal in our entire culture today, right, in the United States. So that's something to consider if you're writing a SPA. The last one is to consider changing some problem areas that you might have in your school Medicaid program. And I'll give you one example. There are several states that I'm aware of that have like a pre-approval process. So before you can bill for reimbursement as a school district, you have to bundle up all this paperwork and send it into the Medicaid agency for a pre-approval. And that's not usually just something for school Medicaid. That's usually a requirement for their whole Medicaid program. Usually applies to clinics and hospitals and doctors' offices and that kind of stuff. And they brought that regulation over to the school Medicaid program. Doesn't really fit in some ways, but there are a couple of states who've gone just way off the deep end with this. There's one state that I know that requires this pre-approval for every service, and that pre-approval is like a 20-page packet of forms. And here's the worst part: the pre-approval is only good for 60 or 90 days. So multiple times every school year, the school district has to put together this big packet of information, send it into Medicaid for pre-approval before they can bill for reimbursement. If you're writing a SPA for free care, this is a great opportunity to maybe take care of some of those kind of things in your school Medicaid program. You know, several years ago, California legislature, again, passed a law, and again, it was signed by the governor, and it said, Medicaid agency, make it as easy as possible, remove as many barriers as possible for school districts to participate in the school Medicaid program. Now, they definitely want the school districts to be fully compliant. They want them to follow every single rule and regulation, and everybody wants that. But they did direct their Medicaid agency to remove some of these kind of barriers. There are lots of examples of those around the country, and when you're writing a SPA, this is an opportunity. So now let's say you're at the Medicaid agency and the SPA has passed. You've gotten it back from CMS, it's been approved. You've got some things to take care of on the post SPA side of things before you roll this out to everybody. You really need to audit or alter your audit processes, your internal processes, because I am guessing, unless you're in Wyoming, all your school Medicaid stuff has been built around special education. All of your auditors who go out to school districts, I've seen them, they have checklists, and the checklists include things like the IEP and the services page and the parental signatures and the evaluation. Very special ed driven. Okay, you need to alter all those processes, because now your auditors could go out to a school district and they're going to be looking at documentation for a student who has nothing to do with special education, has never received a special education service, and they need to be trained for that. The other area for training is if you're in a state that does the random moment time study via email, where somebody gets an email that says, what were you doing at 2 o'clock yesterday? And I start typing all this kind of stuff of what I was doing. There's somebody back at the office at the state agency who reads what I just typed, and they code it for a specific kind of response. Again, those coders may have received training or orientation all around special education, and whatever I'm writing about what I was doing yesterday at 2 o'clock, they filter it through that language. So there's a lot of internal training and a lot of internal processes at the state agency that need to change. And then my last recommendation is for the state Medicaid agencies to really proactively reach out to the school districts for intensive training, extensive training, because this could be a major change. And school districts are going to have to figure out, and we'll talk about that in just a second, their own internal processes. But I think it's incumbent on the state Medicaid agency to really reach out, maybe in conjunction with the Department of Ed. Some states have a really great relationship between those two departments, others not so much. But the other folks that I think need to be involved in that are the billing companies. School districts really rely on their billing companies for expertise, both on the Medicaid side and the education side. And I think they really need to be involved in that training, and deliberately so, not just accidentally hear about it from one of their school district customers, but really invited into this. Okay, I'm going to hop over to school districts right now. So you're a school district. Your state has just passed free care. The state Medicaid agency, the DOE, they're having training classes and all this kind of stuff. What's going to happen? Well, here we go. Internal operations today, before free care, where are all of your school Medicaid records today? Likely they're in the special education department. What is the authorizing document? Historically, what has been the authorizing document allowing you to bill for reimbursement? And where is that? Well, it's probably been the IEP, and that's probably in special education too. So you really need to adjust your internal operations, realizing that you could be filing for reimbursement for any student in your school district who's Medicaid eligible, right? And all that stuff might still live in special education, or you might carve out a special place for Medicaid that covers everybody, but you need to make sure that you know exactly what you're doing with that. Next one is professional development for your staff. There are still school districts out in the big wide world, and this drives me crazy every time I hear about one or every time I talk to one, but they only want their providers to document for Medicaid eligible kids. As a matter of fact, a lot of these school districts ask for a list of Medicaid eligible kids to give to their providers, and those are the only ones they document on. I think that's terrible in general, but think about the free care world now, where every student in this school could potentially every Medicaid eligible student in this entire school, not just over in the special education world, could be eligible for reimbursement. So do you think it's feasible to give a school nurse a list of every Medicaid eligible student in this entire building? Probably not. They definitely need to be documenting stuff on a regular basis. They don't always have the tools that make that really super duper easy. So I think the school districts really need to adjust their documentation level and find good, smart ways to cut down the amount of time. The next one, I'm going to skip the additional administration and jump to parental consent. Today, who talks to parents in your school district about school Medicaid? 99% of the time, it's the special ed department, right? And it happens in an IEP meeting. These are kids you're going to be receiving reimbursement on potentially who don't live in the special ed world. They don't have IEP meetings. Their parents do not come to the school district once a year for a regulated meeting like this, okay? Who's gonna be responsible for talking to these parents? Where are you going to store this data, the parental consent form, when it comes in? You've really got to figure that out, because it's not going to be just as neat and easy as it has been with a mandated annual IEP meeting. Last one I'll talk about here is really the audit prep. School districts get a notice from the Medicaid agency. We're going to audit you. Here are the 20 services that we want to audit. Provide the documentation. Only 14 of these services are coming from special ed, where you already know exactly what you're doing, putting together your audit information. 6 services are coming outside of special education. Where are where's the documentation for that? Where are the provider notes and the signed provider notes? And what's the authorizing document? Over here in special ed, it's the IEP. What is it for counseling services in general education or nursing services in general education? You're going to have all that stuff figured out before you start submitting your first claim, because again, you could be notified within a month of submitting your first free care claim that you're being audited for it, and you want to have your processes down. Last one I'll talk about is billing companies. So many billing companies started off the same way in school Medicaid. It was a special education director who knew a programmer, or it was a school business manager who understood the school Medicaid program and knew a programmer, and they got together and wrote some stuff. But a lot of that initial software and a lot of the software that's evolved today was and is tied to special education. I have seen lots of logging software that asks questions about, do you have this part of the IEP, and is this on the services page, and all that stuff. And you need to make sure as a billing company, if you're providing software to your customers, you need to find out if it's going to pass the test of a standalone non-special education reimbursement from Medicaid. Okay, in a lot of cases, IEP software companies have formed Medicaid billing agencies, and they use the same software. So if you're a billing company and people enter their documentation for Medicaid through the IEP system, how's that going to work for your customers moving forward? I make sure that I recommend to billing companies that you do an exhaustive check of your software systems, because if free care is coming to even one of the states you cover, you're going to have to make some changes probably. Second one is the consulting processes. Again, most billing companies in the school Medicaid world know the school side, and they know the Medicaid side. And the school side, they really know all the special ed stuff and the evaluation forms and the present levels and all that kind of stuff. But you need to know the rules around the new authorizing documentation. If you're in Connecticut, if you're a billing company in Connecticut, you need to understand all the rules around 504 plans, because that's the way that they expanded around free care. If you're in Florida, you're going to have to understand the rules around every service, because they did not just limit it to services on a 504 plan. And last one that I've got here is that a lot of billing companies provide audit prep service, where they actually go in and organize the audited records before the auditors come in. You know, they do that for their customers. Again, you're going to have to know everything those auditors know out there. And you're going to have to be prepared for that, because the very first month that your state is involved in free care, you could be called to offer your audit prep services. All right, last one I'm going to talk about real quickly is the state Medicaid agency relationship. And I talked about this before. My general perception around the country is that a lot of states don't have a great relationship between the state Medicaid agency and the individual school Medicaid billing companies. And let's face it, the Medicaid agency has to deal with tons of billing companies, not just school Medicaid billers. They're dealing with tons of health plans and all that kind of stuff. So it's not unusual that there's not really a great warm fuzzy relationship, because they have to deal with lots of people. And let's face it, the billing companies are not their customers. The customer of a state Medicaid agency is the health plans and the hospitals and the people who are covered receiving coverage under Medicaid. So if you're a billing company and one of your states or multiple of your states are going down the free care road, I think, even though you heard me a little while ago recommend that the Medicaid agency reach out to the billing companies, I'm going to say to the billing companies, you reach out first. Reach out and contact your Medicaid agency and find out if they can give you resources and documents and training, those kind of things that are only going to help you help their customers, because their customers and your customers are the same, right? The school districts. So here's my contact information again, if anybody wants to have a discussion. Thank you all very much for showing up today. I really appreciate it. Hopefully we'll see you or hear you on a future Lunchinar. Bye, guys.